Hey everyone, I'm Dr. Blake, and this is a PowerPoint that I made for people with chronic illness as well as family members or friends of those with chronic illness. And in this PowerPoint, I'm going to lay out for you really some fundamentals of how to start healing from chronic illness, even when you feel like you've tried everything. The main objectives that I want to cover in this presentation are the common problems that are encountered in medicine, in particular those problems that are encountered when we have chronic illness. I want to talk about the common reasons that people get sick and stay that way. And then once you understand that, I'm going to tell you some things that you can do to start getting more out of what you're already doing. And then I want to lead you through my ORST method that I've developed, which is what I use with my patients every day. The first distinction that I want to make is the difference between acute and chronic illness. Acute illness, by definition, is something that we can get over on our own. We can be very ill with an acute illness, take the flu for example, but by definition we get over it on our own and we don't actually have to do anything to make sure that we get well. If we do any medical treatment, it's usually symptom-based treatment. It's something to help our symptoms feel better without actually having to do anything to support the healing process. Sometimes those acute illnesses can turn into a chronic illness, so they weren't actually acute, we thought they were at first, then they become chronic, and sometimes we develop chronic illnesses. And this is what I want to talk about today because these are really poorly addressed by the conventional modern medical model. We have an increasing number of chronic health conditions, so we need a different model. Let's talk about it. Because chronic health problems are poorly addressed by the conventional medical model, the typical story that you will hear from anyone with chronic illness is that they've seen multiple practitioners, they've seen multiple specialists, they've been to their MD primary care doctor, they've been referred to, a rheumatologist, gastroenterologist, cardiologist, you name it. They've been to physical therapy, they've been to chiropractors even. The list can really go on. And they've had endless imaging and labs done, and there's been usually medication after medication after medication tried just to see if they can improve the symptoms. None of these medications typically aimed at actually supporting healing of the situation. And sometimes people have had multiple procedures depending on what's going on, and surgeries. A lot of times people go through all of this for a number of years, and all of it really with little to no answers about what's going on with their body or why, or solutions for how to help the situation beyond just putting a band-aid on the symptoms. And as if that wasn't bad enough, a common experience that people have with chronic illnesses is that doctors don't take the time to listen to them. They often aren't believed by those doctors, and their experience will be invalidated. People get told crazy things like it's all in your head. They get told there's nothing we can do and you're going to be sick the rest of your life. And it's the most unfortunate thing that this is the story and the experience that people have. And it's just not true. So it's no wonder that after all of this experience that so many people end up with their hands up in the air saying, I'm done, I give up, I've tried everything. But I want you to know that it's not that no practitioners care and they don't want to see people get well. It's that chronic illness is complex. It is by no means a simple equation, and there are multiple factors involved. So we need a good model to approach chronic illness with. I want to touch on the reasons that we get sick and stay sick so that as we're moving through the rest of this presentation, you can understand how we're trying to undo this patterning. So everything in the world is a stressor to our bodies. Some of them are big, like we get in a car accident. That's a major stressor. Sometimes grief can be a major stressor. For females, child labor is a big stressor to the body. There's also tons of small stressors all the time. We're always exposed to microbes, and there's stresses of finances and work, and you name it. Everything is a stressor. So what happens is either small ones build up over time, or sometimes we get a big one and we develop chronic illness because the body starts to decompensate from this continued stress. And I don't only mean mental emotional stress. Again, infections are a stress to the system. Everything is a stress, okay? So we have to adapt, and we start to decompensate and have an inability to adapt to the different stressors that our body needs to adapt to. And so as we get chronically ill, other burdens start to build up more easily because our adaptive mechanisms are decreased. So a lot of times people will start to get multiple different chronic infections because their body is more susceptible, their immune system's down, they can't get over them, and then those chronic infections further deplete and decompensate the system. Okay, does this make sense? So that's kind of what happens as we get over this threshold of adaptation, is one way to understand it. Okay, and then what happens is we stay in this holding pattern where our body's trying to heal. The body wants to get well, and we might start to feel better for a bit. Maybe it's a few days, maybe it's a week. Everybody's pattern is different, but the body just doesn't have what it takes to get over that hump. And then we fall short, and boom, we feel sick again, and our symptoms flare. And we just sort of stay in that pattern. Sometimes people stay static in that, and sometimes people will worsen over months or years. So this slide is just to quickly illustrate what I was just saying. Health is on the left side of each graph, and as it goes up, health is increasing, so symptoms are improving, and time is on the bottom, going to the right. So basically what we see is the blue arrow is showing us that at that point in time, health is increasing and symptoms are improving, so we feel a little bit better. Maybe that's a good day or a good week. And then the red is pointing to what would be like a symptom flare, so health is decreasing and symptoms are worse during that time. The top graph is an example of pretty stable over time. The goods are about the same and the bads are about the same. The bottom graph is the example where the goods are less good over time and the bads are a little worse, and so there's a steady decline. And this is what we want. This is essentially a graph of healing. We still have the ups and downs. We still have a cycle, which is always to be expected, except this time, over time, the goods are a little bit better than they used to be, and the bads are a little less bad than they used to be. And over time, as you start to slowly increase this trajectory, you end up at a point of healing. So how do we do it? How do we heal? I've developed this ORST method based upon my naturopathic medical training and then my last almost decade of experience of working with patients with chronic illness. So what we want to do is optimize, remove, strengthen, and treat the root. We want to optimize the conditions for health. We want to remove obstacles to healing. We want to support and strengthen weakened systems. And we want to treat the root cause once we've uncovered them. There's not usually one root cause, so we need to do some work to uncover the different factors and treat those root causes. And I want you to understand that healing is the natural direction of things. Once we can remove obstacles and support some of the natural functions of the body wants to be well. The body wants to move in a direction of healing. We just have to get some things out of the way and start to support those natural healing processes that the body already knows how to do so well. So when I'm talking about optimizing conditions for health, the conditions for health are those things that are really basically requirements for the body to be in a state of health and wellness. I can't overstate the importance of this slide enough. Obviously, there could be whole presentations on each one of these topics, but I want you to think about an anti-inflammatory diet, which is also a whole foods plant-based diet. It's easy to find information online about this. You have to optimize sleep. Sleep is arguably the most important piece that has to be in place for us to heal. So we have to do whatever we can to optimize our sleep and improve it, which I understand well that sleep problems and insomnia are very common with chronic illness. Movement, stress management, gosh, stress management just can't be overemphasized. Stress, mental and emotional stress is kind of what I mean here. That happens to all of us, but we have to have tools to dissipate that stress. We have to be able to do something with it, because if it gets internalized, it will contribute to and perpetuate chronic illnesses. There are many other things that you can consider there. I think spiritual health, which is also listed over in the mindset section there, that is a major requirement for our health. From the mindset perspective, I want you to consider your perspective on your life, your wellness, perspective on the world, which also ties into core beliefs like how do you what do you believe about yourself? What do you believe about the world and the way it functions? Is it pessimistic? Is it optimistic? Is it hopeful? Is it defeating? Big topics, but those are super important because those affect how we orient everything around us. What's your self talk like? Do you have gratitude? The world can be crumbling, and I guarantee you there's still things that you have gratitude for. So, gratitude practice can be super important. And spirituality, which I already mentioned, you can add, there's the etc. is there because you can add your own things to this that you consider conditions that you have to optimize for your health. But again, I can't overemphasize this. You could only work on the things on this slide, and you would see your chronic illnesses improve. Removing obstacles. So this list is obviously the same as the one on the previous slide, and I want to talk about why that is. Many of those things on the previous slide, while it's important to work on those actively to make them as optimal as possible, some of those things can actually be straight up obstacles to our healing. One example might be sleep. If you have severe insomnia, that is an obstacle to healing. Healing is likely not going to happen until somehow the insomnia can be addressed. But likewise, just because your diet is not impeccable and you stick to a straight anti-inflammatory diet all the time, it doesn't mean that that's an obstacle to your healing. Now, optimizing that, yes, that's going to help you along the way for sure, but it doesn't mean it's an obstacle. There are many times that my patients come to see me with chronic illnesses and their diet is pretty decent. I don't start picking at that. I'm looking for the low-hanging fruit, the, if you will, the things that are really obvious that if this does not improve or this does not get removed, we are not going to get traction. We are not going to get well. So let me give you two examples that are really common that are not on this list. One is a job. So many people that I see have jobs that they don't like, makes them unhappy. They get anxiety from it. They're depressed from it. Until that job situation changes, that person is probably going to be stuck at a particular point in their healing process. And another common situation is relationships. There are people who are in relationships that are just unhealthy for them and they're unhappy. Maybe they feel stuck, they don't know how to get out. But again, this is an obstacle. So what I want to say about the last slide and this slide is that it really requires reflection, okay? It requires honesty with the self and taking time. Usually journaling is the easiest way. And at least taking some time to journal about these different points that I have here, as well as what else comes up for you in your life that may be an obstacle. And just be honest about what your diet looks like. Take a few days. What do you eat? How does that match up with what you know of an anti-inflammatory diet? Write about your sleep. Get an idea for the last few days or a week, how many hours you're getting, how many times you woke up in the night and that sort of thing. If your sleep's really bad, you already know, but you get the point. So you really have to take time to dig into this, because when I'm sitting with someone, these are the things that I'm really digging into, because aside from anything else that I can have anyone take to support their body or their mind, these are the foundational components that when we work on them, we start to see people getting well without giving them anything. And these things are how you improve the outcomes from what you're already doing. So if you're taking supplements and herbs, you will start to see improvements just from focusing on this. Okay, now we're getting to the fun stuff. So we went over optimizing conditions for health, we went over removing obstacles, and now we're at the support and strengthen weakened systems part. When I say weakened systems, what I'm meaning is the gastrointestinal system or the gut, the nervous system, the cardiovascular system, all of the different body systems. So When you're looking at what needs support, one way to do it is to look at the disease itself, the diagnosis, okay, the condition, and what's involved. So take rheumatoid arthritis, for example. Well, we know that it's an autoimmune condition, so we need to support or balance the immune system, and it also affects the joints, right? So and in the circulatory system as well. So we can start to do things that support those systems. But say there's rheumatoid arthritis, but the digestive system is really kind of messed up too. Easily get indigestion, heartburn, might have tendency to constipation, diarrhea, those sorts of things. That's not exactly like directly related to rheumatoid arthritis, but we can see that that's a weak system. It's just susceptible system. All of us, when we get sick in kind of our own particular way, and we have body systems that are susceptible. So there's three primary ways that we can go about supporting weakened body systems. One of them is to give nutrients that those tissues need for healthy function. So, what would be an example here? Let's see. We can take the example of the cardiovascular system, the in the heart in particular. The heart uses a lot of energy. So, because it's just beating all the time, right? All day. So, one of the nutrients that the heart muscle needs to use a lot of to expend energy is CoQ10. So, that's one example of we can support the body's natural function by giving it this nutrient CoQ10 that it needs to use a lot of. The second thing that we can do is we can use nutrients and herbs or anything else really that supports or stimulates the function. One of my favorite things to do to support digestive function, as an example, is to use digestive bitters. I usually use them in tincture form, and when you put them on the back of your tongue, they stimulate the bitter receptor on the back of your tongue. The nerve that innervates the back of the tongue is the vagus nerve, and that also innervates much of the digestive tract. So when you take bitters, you actually stimulate the digestive system to start increasing stomach acid, digestive enzymes, you increase peristalsis. So that's an example of using an herb that stimulates the gut, but it's just stimulating the natural function, right? I'm not giving it anything to make anything happen. I'm not giving a substance that affects a certain enzyme or anything like that. I'm just supporting what it already does well. And in that way, it can kind of strengthen it. So that's an example of number three. Also, it's strengthening by exercising or lightly stressing the system. So the bitters is supporting the natural function, but we can also view it as we're working it out, right? We're making it do work. So if we want to start to move the needle in the positive direction of healing, we need to slowly push the edges of the body system so that we can start to adapt to little tiny stressors and start to build up again. That brings us to T, treat the root. You kind of have to dig deep a lot of times here. Again, with chronic illness, as I said earlier, it's complex. There's not usually one root cause, but you can sometimes find just two or three that when you get at those, then you kind of unleash the ability of the body to just really start to move forward. So we have to dig deep physically. A lot of times there needs to be in-depth labs that are done. Sometimes we can find some root causes through pretty basic labs, but it's not uncommon that we have to use more in-depth specialty lab kinds of tests. And from a mental and emotional standpoint, there can be a lot of deep digging that needs to happen there as well. Here are some common root causes of chronic illness that are worth consideration. Chronic infections are quite common. There are so many different kinds of infections that people can have. Some common ones would be Lyme disease, Epstein-Barr virus, herpes virus, which is quite common in the general population, can create issues in some people. There are any host of gut infections that can happen. So that's one place that is definitely worth looking into. Mold exposure for some people is a major problem, especially if there's severe ongoing mold exposure. And sometimes there can be mold allergies that people have. So this is something worth looking into. Leaky gut, this is arguably one of the primary underlying causes of all chronic illness, regardless of what it is. There's different reasons for getting leaky gut. Gut infections or dysbiosis, which is an imbalance in the flora in the gut, is and gut inflammation. Those are some reasons that you can get leaky gut. Low antioxidant or detox capability. So the body has to be able to not only detox things that we bring in from the outside world, but things that our body makes, like hormones, for example. Our body has to break all that stuff down and get rid of it. And that is a major linchpin in people getting well. It can be an obstacle that needs to be removed, but it can also be a root cause. The immune system is probably the most common thing affected in chronic illnesses. Maybe it's affected because of one of these other things like chronic infections, but the immune system is often either weak or there's a dysfunction. So dysfunction would be like autoimmunity, and a weakness would just be not having enough capability to fight off foreign invaders, for example. From the mental emotional standpoint, negative core beliefs is something that I really see playing a big role in people's wellness, and can even lead to somaticized illness because of the negative core beliefs. And emotional trauma is so big, it's so pervasive, and there are ways to deal with all of these things that are on this list, including trauma. There are some specific therapies that are really effective for healing emotional trauma, and sometimes that can be the root cause of why a chronic illness is perpetuating. Implementing this ORST method will without a doubt help anyone with chronic health problems improve their function and their quality of life. There are a couple of things to avoid. Avoid focusing too much on individual symptoms and focusing too much on the day to day. And what I mean by that is not focusing on one or two symptoms, but focusing on the whole picture. This is where symptom logs and journals can really help to understand what's the baseline and not focusing on the day to day or even the week to week so much as the month to month. All we care about is that we're moving in the right direction. Low and slow is the trajectory that we should expect, okay? If we're improving 10% in 1 month and then we can improve 10% in the next month, imagine where we're going to be in 9 or 12 months from now. We're going to be feeling awesome, right? Don't expect an easy fix. Expect commitment. Expect that there's going to be work involved, and expect that there's going to be ups and downs along the way, but that this is doable. This is the main thing that I want to impart upon you, is that your body can heal. It first takes that belief and that knowing that it is possible. It takes commitment and discipline for sure, and it takes a process and a method. And so the ORST method that I've just given you, if you start to implement those things, I know you're going to start to see changes in your symptoms and how you feel on a day-to-day basis. If you need support with this at all, I have an awesome program that I put together. It's me and my partner, Dr. Sarah Sue. We cover mental, emotional, and spiritual aspects of health as well as the physical. It's a high-touch program, lots of access, lots of materials, lots of training, lots of one-on-one sessions. So if you really want to fast-track your health and healing process and get the support you need to implement this, I'm happy to jump on a call with you. All you have to do is click the link below this video. We'll jump on a call. I'll hear what your needs are, what you've been experiencing, and tell you what my approach and my solutions would be for it. See if the program's a good fit for you. And if it's not, I will definitely point you in the direction that I think will be the most beneficial for you. So hop on that call, and I will talk to you soon. Be well.